WFYI podcasts are brought to you by TechPoint, presenting the 25th Annual Best of Tech Mira Awards, recognizing digital innovation across Indiana, April 26th at Old National Center. More, including how to nominate, at miraawards.com.
This is WFYI News Now. It's January 12th, and I'm Aubriana Herron. On today's show, Indianapolis Public Schools has a new board president. A local auto workers union reached an agreement to get higher wages. Republicans and Democrats at the Statehouse outlined their priorities for the session. And new federal rules aim to increase staffing levels in nursing homes.
Nursing homes that don't have adequate staffing lead to serious problems when it comes to resident care.
Those stories coming up, but first, a detailed look at redevelopment ideas for West Washington Street corridor is completed, Jill Sheridan reports.
The development of hundreds of acres of property along West Washington Street is the focus of the latest report to find ways to improve the corridor. The City of Indianapolis, Develop Indy, and the Indianapolis International Airport worked together on the plans. Develop Indy Director Aletha Dunstan says it builds on previous studies of the area.
The goal of this was really to deepen that work, but put that work through the lens of economic and market realities.
Sites with greater opportunity are identified and different types of redevelopment strategies are outlined. Ideas include larger business spaces and neighborhood-focused sites along the corridor. There's no timeline, but planners say some developers have shown interest. I'm Jill Sheridan.
Last night, Indianapolis Public Schools board members unanimously chose Angelia Moore as their new board president for 2024. Our partners at Chalkbeat, Indiana, report that earlier this week, board member Kenneth Allen and Moore tied in the board's vote for president. During yesterday's public meeting, Allen did not nominate himself again for the top position. Instead, he was elected vice president over member Nicole Carey. A local auto workers union and Allison Transmission in Indianapolis have reached a tentative agreement, avoiding a potential strike. Violet Cumberweilen reports union organizers negotiated higher wages, among other changes, for more than 1,500 union employees.
The tentative agreement includes historic wage increases, an end to wage tiers, a higher 401k match, and Juneteenth as a paid holiday. George Freeman is the bargaining chairperson for UAW workers at Allison Transmission. He says these changes were necessary, as high turnover and lack of upward mobility was causing a lack of motivation for workers.
And for us to be the world leader in transmission or propulsion system, and we're paying poverty wages, that was just unacceptable.
He adds the new wages are more sustainable, and the elimination to wage tiers makes employees more equal. The ratification vote for the agreement is set to take place next Tuesday. For Indiana Public Broadcasting, I'm Violet Cumberweilen.
Senate Republicans want to significantly restrict insurance companies' use of prior authorizations for healthcare procedures and services. Brandon Smith reports on one of the Senate GOP's priority bills for 2024.
Prior authorization is when insurance companies require pre-approval for medical service before they'll pay for it. Senator Tyler Johnson says what was initially intended to help lower costs and reduce fraud and waste has become a burden on healthcare providers and patients.
Because prior auth slows down or even stops their ability to get care.
Johnson's bill would ban prior authorization for routine and emergency services and common prescription drugs. It also limits the amount of prior authorization insurers can require to 1% of healthcare providers and 1% of any given service.
But we don't need somebody second-guessing every claim.
The bill also puts time limits on how long an insurance company can take to approve prior authorizations. For Indiana Public Broadcasting, I'm Brandon Smith at the Statehouse.
Indiana Statehouse Democrats say it's too expensive to be a Hoosier. The House and Senate Democratic caucuses unveiled a joint agenda yesterday aimed at addressing the cost of childcare, housing, and health care. Senator Shelley Yoder says Republicans' plans to address childcare access fall short. She says significant structural change is needed.
Currently, providers are only able to accommodate about 41% of the 500,000 children who need childcare, meaning that 600,000 parents are left with no options.
Democrats want to dramatically expand funding for childcare, including universal pre-K access. How to pay for it is less clear. Yoder suggests using the state's surplus. which is limited and already reduced by a Medicaid funding shortfall. And for our final story today, many nursing homes face staffing shortages that can lead to inadequate care and dangerous environments for seniors. The Biden administration proposed a new set of staffing requirements in an attempt to address that, but some say that proposal could cause more harm than good. Natalie Krebs reports.
It's noon at the Prairie View Skilled Nursing Home in Sanborn. Dozens of residents are in the cafeteria. They dig into their tater tot casseroles and vegetable beef stew.
So they get to pick between like 3 salads, 2 main meals, 3 desserts, whatever they want to drink. And it's always good.
That's Wendy Nelson. She's been the administrator at this rural nursing home in western Iowa for nearly 2 decades. It's noisy in the cafeteria. But this changes quickly as Nelson leads me to the end of one of the halls to a unit behind a locked door.
So this is kind of sad. We'll walk in here. But totally empty.
This is, or was, Prairie View's memory care unit. It closed in 2022 due to staffing issues.
We were kind of in a situation where we had 8 residents out of 16. And again, you have to have a nurse for the whole 24 hours. You have to have at least 1 to 2 aides for the whole 24 hours.
Nelson says staffing shortages have gotten much worse since the pandemic, when she lost many staff members due to burnout. The nursing home is only at 60% capacity. In March of 2020, Prairie View was nearly full. Nelson says she's not getting applicants even though she's significantly bumped up pay for all positions from nursing to housekeeping.
You're able to go to Casey's, and get paid pretty good nowadays, or McDonald's.
This summer, more than half of nursing homes reported turning away prospective residents due to labor issues, according to a survey from the American Healthcare Association. But chronic staffing issues affect more than bed space. When they're understaffed, residents are more likely to receive poor care at nursing homes. The Biden administration proposed setting a minimum staffing level for nursing homes in September. They include having at least 1 registered nurse on site at all times and having a mandatory minimum amount of time employees spend with each resident daily. Labor unions representing nursing home workers and senior care organizations support the new rules. They say it will make nursing homes safer. Brad Anderson is the executive director of AARP Iowa.
We have seen time and time again nursing homes that don't have adequate staffing lead to serious problems when it comes to resident care.
Not everyone feels the same way. Last month, a group of Republican governors, including those in Iowa, Nebraska, Missouri, and Indiana, sent a letter to the Biden administration. They urged it to reconsider its mandatory staffing proposal. They said they fear it could force more facilities to close. The American Healthcare Association, which represents nursing homes, estimates the rules will ultimately require facilities nationwide to hire more than 100,000 full-time workers who don't exist.
A mandate is not going to create another single worker.
Brent Willett is the president and CEO of the Iowa Healthcare Association. He says lawmakers should instead focus on policies to help increase the workforce.
We should be talking about legal immigration reform. We should be talking about tax credits for healthcare workers and other strategies to find ways to fund apprenticeship programs.
But some nursing home workers say they'd like to see the requirements in place. They would also like to see nursing homes held more accountable for staff safety.
Unless it's forced, it will not happen.
Savannah Hintz is a registered nurse who worked in Iowa nursing homes for a decade. Hintz left because she felt the for-profit facilities where she worked prioritized her bottom line over patient care and worker safety.
They're dealing with people who have dementia or strokes. These are adults who are physically strong, and the training isn't there. Instead of these companies investing in dementia training, they are just putting it elsewhere.
Hintz says she'd like to see policymakers make sure nursing home workers get the support they need. I'm Natalie Krebs, Side Effects Public Media.
Side Effects Public Media is a health reporting collaboration of NPR member stations across the Midwest, based at WFYI. That's all for today's episode of WFYI News Now. Our podcast is produced by the following people who live in your community: Darian Benson, Drew Dodlin, Kendall Antron, who composed the music for this podcast, and me, Aubriana Heron. Our news director is Sarah Neal Estes. If you liked today's episode, remember to subscribe and share, and follow WFYI on Instagram, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening, and we've got Monday off, so we'll be back on Tuesday.
WFYI podcasts are brought to you by TechPoint, presenting the 25th Annual Best of Tech Mira Awards, recognizing digital innovation across Indiana, April 26th at Old National Center. More, including how to nominate, at miraawards.com.